9 o'clock. 9 o'clock? 9 o'clock.
Got it.
Okay, it's 9 o'clock. We'll call the meeting to order. Take the roll, please.
Good morning. Joe Baratka. Paula Hodak is excused. Robert Kopish.
Here.
Patricia Stephen. Here. Dennis Worko. Nicole Kolwicki is also excused. Sally Hummel. Suzanne Acker. And Gerald Swenson. Thank you.
Okay, next item is public comment and communications. Is there anybody here for public comment? Okay, I don't see none. Is there any communications from anybody? All right. Then we go to new employee introductions.
Okay,
Do you want to do that org chart at the same time, or do you want to do that later?
we could do that later.
Okay, all right.
Okay, I'd like to introduce Beth Moore, which I think Beth has been here since 2008. Is that right? Oh, 2013. She is our lead economic support specialist. She has replaced Jenny Shu. So we welcome her, and I'm going to turn it over to her because she's going to introduce one of her new employees. She's been on the job for a month, and now has a new employee to replace.
Deanna Bertland, who started on Monday, so we've been really busy getting her acquainted with the office and getting her security clearance. So, busy.
And what was that name again?
Deanna Bertland.
Deanna Hertland. Okay, you turned away when you said it, and this is my bad ear, so. The other one's not much better. Anybody else? Is that it? Okay, welcome. Thank you. And vouchers. Did you have anything to look up?
Just a few things. They got to work.
Oop, just a few things. It wasn't too hard.
No, I didn't think so. I usually have a bunch of questions, and I was kind of remiss, and I give her a heads up, and I did it this morning at 5:18. So
I wasn't awake at that time, but I got it when I got here. Do you want me to just go through what the questions you had or
Sure.
see if anyone else has anything?
yeah, if you want, you just go through what I asked, and if anybody else has any other questions, we
Okay.
can take it from there. Thank you.
So on the first batch, there was a payment of for source services for $5,133. That's services provided by a mental health counselor out of Ashland. He provides counseling and consultation services for clients in the Comprehensive Community Services Program. We've been having more clients, so there's been more of a need, but that program is reimbursed by medical assistance at 100%. So we're not out any money as the county. Signature Signs had an expense of $1,955. That was for a billboard rental for 1 year for the Mental Health AODA Coalition.
So that's a reoccurring then?
I think it's once a year they renew. Yeah, if they decide
Okay,
to.
where's that billboard?
I think it's right out of Park. I think it might be right outside of Park Falls when you're coming into Park Falls.
Right by the Fort Super One.
Yeah,
Okay.
on the left side.
Okay, all right.
The new
Before bridge
billboards
or after-
there, yeah.
Yeah.
Okay, thank you.
Then we had an impact cleaning bill in the third batch for $1,410. That was just services they provided. We had a client that was left her apartment. I believe she may have moved to the nursing home, but they just had to clean out her apartment, and we used money from our elder abuse grant for that.
Okay,
Fourth batch was a check to the Wisconsin Juvenile Court Intake Association. That's the one we pay a big chunk every once in a while, but we're the fiscal agent for the state. It comes out of our juvenile justice grant. It's just basically a pass-through account. They bill us, we pay them, we get the money back through Spark through the state. So.
okay,
And then there were several bills that we paid to Taylor County Human Services. The first one was about 25,000, then it went up to 30,000, and the final one was close to 44,000. And that is a lot, but it's for counseling therapeutic services for clients in that same program as our counselor was for, the Comprehensive Community Services. Again, that's refundable by MA at 100%. And there are more and more clients being added to the program. As of December, I believe there are 31 or 21 clients. So it's a growing program, and so they need more services, but we get paid that back 100%. And then the final one was a bill for Heartland Business Systems for $8,452. That was just laptops, replacement laptops for 3 of the children and youth employees. And that was paid as part of our Safe and Stable grant. So that is also reimbursable.
Okay, thank you. Anybody else have any questions? Okay, where are the vouchers? Do we have vouchers to?
I gave them to you when I got here. I thought should be 3 all stapled together.
Where?
Yep.
Oh, there they are. Okay. Yeah, I was looking for a big pack. Okay. Well, what's your pleasure? You want to approve them and then sign them, or you want to sign them and then approve them? Do you care? Huh? Okay, well then let's do a motion on the vouchers and then we'll sign them after. Is there a motion?
I'd make that motion to approve.
Mr. Brodko, is there a second?
Second.
Mr. Wartko, any discussion? All in favor, say aye.
Aye.
Opposed, no. Vouchers are approved. Okay. Got our minutes from our November 5th meeting.
Motion to approve as presented.
Okay, is there a second? Okay. Mr. Swenson? Any discussion on the minutes? All in favor, say aye.
Aye.
Opposed, no. Minutes are approved. Public health. Nope, we're not doing that. Excuse me. We had a change in venue here. We're gonna go to Kayla Borgen, right? Okay, Kayla, you're up. You got to get out of here, I guess, right? Yeah, okay.
So her quarterly report is kind of in the back a little bit, so it'd be the Price County CNY placements.
It should be number 7A at the bottom there.
Yep, okay, got it.
Okay.
But yeah, they're way in the. Way in the. Do you have 3 of them there? 2, 3 sheets.
Everybody got it?
There.
Okay, just going through our 3 pages, and just Q4, as you can see from the first page, we would have had 20 kids in out-of-home placement. 11 of them were placed in the county, 9 placed out of the county. 50% of those cases were drug-related cases for out-of-home placements. The next graph shows the Q4 placements and then the types of placements and the costs for those placements. So as you can see, only 2 children in group home came to $72,685 just for that quarter. And then 1 child being placed in residential care was $59,782. So when we're seeing rising out-of-home placement costs, it's because all of those out-of-home placements are just continue to increase in how much it costs. We do work pretty hard to try to keep kids local if we can, but the ones that have to go, I mean, they've exhausted all of our options probably locally as to what their needs are. And then
Kayla, so so that would be divided by 3. So
yes,
this would be for 3 months.
yep.
The 59.
So the $17,000 a month one is that the big one?
I think that was the group home. Yeah, it would have been one of the big ones. Yep. Mhm.
And I just kind of want to add in to the placements with Kayla is that she has some placements that are coming down the pike
Mhm.
that are going to be pretty expensive. We have now staffed with Chana to see if we can kind of find some type of placement to decrease the cost. One cost for an assessment is, what was the cost for the
For the
90-day?
The 90-day, $58,000,
For a 90-day for an assessment, which,
$624 per day.
so we've been trying to search to try to find somewhere else in the state that, but nobody takes, certain behaviors. So sometimes we're kind of just stuck at the placement. So we're still searching that out and with other units.
Yeah. Yeah. And another one for Northwest Passage for 30 days will be 37,000. And it sounds like, I mean, and those families have a ton of services being like in their home between our unit and Chauna's unit, trying workers. I mean, there's probably 4 workers of different sorts, maybe even more, working with those families in the homes and in the schools, to try to do what we can to keep them in their home. And if we're up to other agencies like the schools or the law enforcement, there's about 8 others that they would like placed. So we're working really, really hard to keep those kids home the best that we can. It's just really been really difficult. And then the next graph, our Q4, it shows for obviously for 2022, the total out of home placement, or for 2022, 2023, 2024, and then it breaks down 2025 in just quarters of how much it costs per quarter, with a total of $671,991 for the 2025 year. I'm sorry.
Well, it almost sounds we're starting out the year on bad foot with the kind of numbers you're talking about. What did we do with our budget this year? Did we keep it the same, or did you know if we increased it? Because we were a little over. We weren't over as much as we thought we were going to be, but
I don't know.
you don't know where we're at.
She's looking.
I bet the lady in the corner there knows. Did we raise it?
I don't think we did it. No, not yet. Oh, thank you. I'm starting to forget all the things in my head and I have to look back.
It only gets worse as you get older, you know.
I know.
Yeah.
Yeah, it does look like we dropped it.
Yeah, okay. Oh, it's going to be tight then. Yeah, okay, thank you. You're up.
Believe her reports are on the bottom, probably the very last. The maintenance.
Okay, so first we're gonna go over the Price County 2025 Q4 monthly estimate.
Wait, hold on 1 second to the. Yeah.
Okay. Right here. No. That's not it.
Where's the packets looked? Did you see this one? The non-rental maintenance?
That should be 9A.
A?
9 and 9A at the little bottom right-hand corner.
I can do 9As or 8As. There's a 6A, 6A.
I bet here, right here. way
Oh,
on
it's
the-
under here? On here?
You're looking way on
There
the
we go.
bottom,
Okay,
very last.
okay, we got it. All right.
Okay.
So the left-hand side is for Price County and the right-hand side is the totals for the whole consortium. So I'm just gonna go over the Price County totals. So we had 1,030 food share cases with 1,823 recipients, with an allotment issuance of $251,455 for the last quarter. So the total number of healthcare cases, referred to as MA cases, was 2,425 with 3,799 recipients. And then we further break that down into categories. So Badger Care and childless adults is healthcare for families. And we had 1,203 cases with 2,416 recipients. Our elderly, blind, and disabled cases were 224 with 217 recipients. Our MAP program was 153 cases with 158 recipients. One new thing starting this year for MAP is everyone that is on that program is required to pay a monthly premium. And if they don't pay that premium, they will lose their coverage. The Medicare Savings Program is a program that pays a Medicare Part B for our clients, which I believe is like $202 this year. So we had 408 cases with 424 recipients. Our long-term care cases, those are individuals that are either in a nursing home or have in-home care coming in to help them with daily needs. 158 cases and 161 recipients. Our other IM programs and caretaker supplement cases was 258 cases with 410 recipients. Caretaker supplement is a cash benefit that can be paid for parents who are on SSI and have children. And our childcare, we serve 7 families with 9 children, with an allotment of $5,001.38. So then the next page, oh yes.
Can I just question the number? You're going to go to this one then, the year-to-date or what?
I was just gonna let you guys read the year to,
Yearly total?
the
Well,
yearly
The
one.
question I have is when you say fourth quarter monthly estimate, is that the whole fourth quarter?
it is.
Because you go from 250,000 to 2,977 for the year.
Yeah, this is the year, so this is just the quarter.
But that's,
That's a huge difference, yes.
yeah, I would say
And it
4
can.
times
It
250
really
is a million, not
fluctuates.
2.9. Yeah, so this is way low compared to this.
Exactly.
Yeah, okay.
And it really fluctuates throughout the year when people are eligible and ineligible. It depends on companies that lay off, when they're laid off for 3-4 months, then those people receive food share for those months
Okay,
and then they go off of it. So
okay.
it does fluctuate a lot.
I guess so, yeah, that's quite a difference. Okay, thank you.
Yeah, so the next one I was just gonna let you guys read at your leisure, but you can see it was almost 3 million for the whole year of food share that came in. And then the last one I have is something that you guys probably have not seen before, but what we have is a benefit recovery team as part of the Northern Income Maintenance Consortium. It consists of 3 workers. If anyone needs to know what it looks like. So we have 3 workers and a supervisor. One of those workers is full-time, along with the supervisor. The other 2 are half-time. So they work for benefit recovery half-time, and then the other half, they're doing Northern Consortium duties besides benefit recovery. So they had quite a busy year. They had over 900 fraud and overpayment claims that they completed this year. So fraud cases or claims and overpayments, we had 217 that got completed. Those are situations where someone may be turned in for fraudulent activity and we determine if it is fraud or not. And they may not have reported income accurately. And so then we have to go back and determine how much they received in benefits that they were really not eligible for, and they have to repay those benefits. So then the CSI investigations, so that's where we actually have an investigator go out to these homes and determine how fraudulent someone is being. They're very costly and time consuming, so we only did 60 for the year. We do have 67 backlog that still need to be completed. People get really anxious when the investigators come to their house. They talk to them, neighbors, they get bank account information, employment information, criminal information. They really do an in-depth search. So then based off of that, we determine if they receive benefits they shouldn't have. Most commonly, it's household composition, not reporting the boyfriend, child's fathers in the home. So then you can see we recoup $580,137.14 for the claims and overpayments. Now, we haven't actually received all that money back yet, but what we did do is establish repayment agreements with the people who have to repay that. Any adult in the household who was a member of that group is liable for that repayment. If they do not pay, we do tax intercept. So then the other one you'll see on here is this WICA overpayment claims. So our system is linked with the Wisconsin state wage system. So every quarter, the Wisconsin state wage system uploads clients' quarterly wages. If those wages don't match the income we have on file for them, we get what we call as WICA discrepancy. So basically, they're not reporting their income like they should. So we had quite a few of them as well. Any questions?
Question.
No.
Yeah, there isn't.
Patty?
Hi. Okay, so most of these are people faking information. Are any of these people that don't exist and they're using social security numbers and things like that?
So in all of my time here, we only came across maybe 5 applications where they were fictitious social security numbers and people, but they were caught prior to processing the application. A lot of times when we do get these, the state is aware of them coming through. I don't know how, but they'll put us on a lookout for fraudulent information, and then we're just more aware of that.
All right, thanks.
I just want to add something. I got an email this morning. So did Beth this morning, I believe, from Steve. Maybe you didn't
I
see
don't
it.
think I did.
But the Wisconsin met the federal share active error rate goal of remaining under 6%. And he put out, I'd specifically like to highlight that the Northern achieved an impressive 3.5% error rate. So it sounds like our Northern income is doing a fantastic job. So I know he also sent, that was to you guys, and then he sent one to us, which he said that the error rate is, we're one of the top 3 of the states that ever have achieved this. So.
An error rate affects funding, so it's very important to have it low.
Tiffany, all set? Okay.
Okay. For the public health quarterly activity report, it looks like this.
Should be number 5A in your packet at the bottom there.
Yeah, that's right. Yeah. I'll get there.
You a mess today?
I'm a mess. Thanks, Joe. We're good.
Okay,
All
sounds good. And
Oh, we do have 5A at the bottom, but we can number them all next time. Definitely. Yeah, we put it by the item number at the bottom right.
Of course, then we switch the agenda and then we get
Yeah.
it all goofed up. Yeah.
I tried to put it in order.
Yeah.
And we kind of changed up the agenda. Otherwise, everything would have been right in order.
I'm glad somebody else is having trouble other than just me.
I'm not gonna say anything.
No, I'm glad she started doing this.
the good thing is the format I haven't changed. So, but you're so we'll start off with communicable disease for the 4th quarter. Immunizations. So we gave 980 immunizations during that quarter. the breakdown of that is on the very back page if you want to see it by vaccine and what we gave. But what you're going to see obviously is an increase in our influenza vaccinations during that point. With that, the next thing shows you where we kind of gave some of those. So we are, during the flu season, you may see our flyers out. We are in businesses and in community flu clinics. So we gave 315 flu shots at local businesses, and then 65 at our community flu clinics so that we can get to the people, the residents where they're at, and keep them going on with their day. You can also see then as well the COVID-19 vaccine numbers. We gave 171 of those vaccines during the fourth quarter. Additionally, just as for education and awareness, we had 2 of our nurses attend a regional summit. So that just helped us work with our regional partners on investigating diseases, reportable diseases when they are sent to us. And with that, then one of our public health nurses also goes out and does bloodborne pathogen training to some of our local entities. So us at Health and Human Services were trained, and then 2 local ambulance services. And then additionally, HIV Partner Services, if you recall, that's where we cover this multiple counties for HIV Partner Services, and we had 2 case follow-ups during that time. Just a breakdown of the cases that we had seen during that quarter. We had 58 reported cases. You could see the breakdown of that. The ones that are included in the miscellaneous category include 2 asbestos and 1 pesticide-related case. Moving on to maternal child health, WIC saw an average participant enrollment of 218 participants over those 3 months. And you can see the dollar amounts there of what was redeemed. PNCC is our prenatal care coordination program and our targeted case management. So we're working with high-risk pregnant moms and families. We have 8 in PNCC and 7 in targeted case, which is up from especially the PNCC numbers that continues to stay at a higher level. We have a nurse that's very dedicated to reaching that population, especially given the changes that we have seen, not just locally, but regionally and even nationwide in the in OB services that are being provided. So just trying to provide that extra support for those individuals. And then our reproductive health program, we had about 20 unduplicated clients during that time. Environmental health, we had 3 complaints. 2 of them within the city of Park or of Phillips. I'm sorry. Those went to the city themselves, and then the other one was the Ogama property that we met on during that time. 3 radon test kits that required or that recommended mitigation. We did not have any elevated lead during that time, and you can see our animal bite numbers had gone down during that time. But I can tell you this quarter they're going back up already. So
Tiffany?
yes.
So on the radon tests,
Yeah.
I've had this asked to me before. If they come to public health and ask for a test,
Yes.
so it says recommend mitigation. So is there a requirement for if they have a high level that they're required to do something, or is it just an advisory for them and it's still up to the
It's an advisory. So then they can follow up with a long-term kit and just to get a better span of time, and then recommendations are provided for mitigation.
Okay, but final implementation of a system is still the choice of the landowner?
Yeah.
Okay, all right, thanks.
Mm-hmm. I think it would be unless there would be an absolute concern, but then it would go to probably be brought to the board to discuss, and it would probably be something where maybe children would be involved and there'd be multiple units involved, but right now it's at the discretion of the homeowner. Mm-hmm. For preparedness, we looked at, we put our mass flu exercise for the school districts in this category. I know we talked about immunizations at the beginning, but we use that activity to prepare us for like the pandemic and things like that, where we would have to give max vaccination. So yearly we use that and as a true exercise. And with that, we were able to vaccinate 262 students and staff right at the schools. So they didn't have to leave, no appointments or anything. So that helps protect our schools and our community. And then we also worked on some of our emergency shelter plans with emergency preparedness. Michaela, who is our preparedness coordinator with Roxanne, went to the Schwamigan and Phillips schools. They met with Red Cross, the superintendents, to look if we would need to implement a shelter, kind of just a review of what the facilities look like, and provide updates. Those plans, we still have to meet with Prentice, but those plans will be coming out then. Community needs, and planned. So we are involved in quite a few activities through our coalitions and through some of our grant opportunities. One of the newer ones that was done last year in October was the Price County Youth Olympics. Actually, it turned out to be a very successful event. It was held during fall harvest. They had about 41 participants, and it was to promote socialization and physical activity. So we get an MCH grant that we apply for, and there's multiple things that you can work on for that. For one of ours, it was the nutrition and the physical activity. So with that, then they held the event down here at the park, and did different activities with the kids. It was free to families, as the grant covered the expenses, and it was showing them different things that they could do as a family, different activities, fun games, things like that. And then there was prizes available. They had a hydration station with snacks. It was very well received. I do have a couple packets I'm going to leave here at the end, just of some pictures and actually what it all entailed, so that you can look through it. There was a lot of hard work that was put into us. Public health represented very well during that. And we're hoping to continue that. We've been very good at having some ambitious nurse staff that like to get out in the community, so I appreciate that. Additionally, they attended the family engagement night in Prentice, so there was nutrition education offered. And then, if you recall, in the prior years, we had provided those bento boxes at the trunk or treats. We weren't able to attend a trunk or treat event down in Prentice at that time, so they used this as that event for it. So then all of our communities were able to get those that education and those supplies. So, and then they did attend another trunk or treat this year through the coalitions and through just public health general information. Again, you can see Health and Wellness Coalition, they supported each of those events. And then the Substance Use and Mental Health Coalition additionally did the same things. Going back to that engagement night, they were able to work on the family connections portion of it. They had supplies donated by Gabrielson Concrete to do a stepping stone activity with families. So they had really good feedback on that. During that time, they were able to provide some really good information on the Small Talk campaign, and then share important mental health education and information. We continue to provide harm reduction education and supplies. You can see we did that at the Senior Expo. We attended the Hidden in Plain site. We provided the Hidden in Plain site at the sextortion presentation that was at the Phillips High School. And then you could see the number of additional supplies that were given out during that quarter. And then additionally, agency-wide, we continue to provide our education through our monthly public health newsletter and through our Facebook posts, and also taking up some interviews with the local radio station, just in, when there was concern with individuals in our area not getting nutrition supplies during the government shutdown. We were able to increase awareness of WIC services as well as food pantries by getting on the radio. So, any questions on any of that information? Okay, and then just a quick blurb for respiratory illness update. I had to pass this out when I went at the beginning. This is so recently we've have seen an increase in respiratory illnesses. What I've provided to you today on these graphs, these come from the Department of Health Services. These were last updated on the 5th. So another update will probably come out tomorrow. It shows you trends of what we're looking at. So you can see statewide, just overall respiratory illnesses, we're starting to see a decrease in that. And this is based off of ER visits. While here in the northern region, we were still seeing a high activity during that time. And that is now decreasing. And you could see it broken down by COVID-19, influenza, and RSV. Influenza seems to be remaining a little bit higher. We had seen a little bit with influenza A coming down, and then it was picking up a little bit of the influenza B. So overall, though, in general, we are seeing that trending downward. So this is something that we keep an eye on very regularly at Public Health. Additionally, we are going to be getting some Essence data that will provide real-time data to us on ER visits. We are signing up with the state on that currently. That'll give us a better idea of in real time what is happening as far as illnesses in the area. Probably about 2 to 3 weeks ago, we were notified that the school districts were seeing quite a significant number of kids being, or students and staff being out due to illness. Our response at that time was we connected with each of the school district. We connected with all of the local clinics, and including their infection prevention individuals, and tried to get a good grasp on what was going on. We increased our community awareness through our social media posts. We were putting out letters to the schools, and the schools were then in turn getting those out to families. And we did another interview with the radio at that time, just trying to let everybody know, yep, these are the numbers we're seeing and what we can do about it. And then we continue to maintain communication with the clinics during that, and even the regional area, regional health officers, we were connecting on that. So I just wanted to give you a snapshot of what we continue to monitor all the time, really. But really, when we see illnesses go up, we're looking at these numbers, looking at what our vaccination coverage is in our county, and how that compares with our surrounding areas, and then communicating that to the public and communicating with our partners so that we're all providing that same message to prevent further spread of the illness.
Tiffany, in general, do our numbers track a little higher than the state as a percentage of total as far as these issues, the respiratory?
Yes. So as you can see, that top box is the state.
Yeah, that's 17%. We're at 22 here at that last number. Is that, and that probably has to do with age of the population?
It could be. Yeah.
You look at the graphs and
yeah,
we're definitely higher.
Exactly. And that's why too, we were working with the state on, like I said, the Essence data so that we can kind of see a little bit more into that ER data in real time, because then we're going to be able to see what our trends are right here in Price County. Like we can see them regionally, but we want to dig a little bit deeper. So that will probably provide us with that and give us kind of a range of where we are seeing it just based upon the ages too. And then that helps us target our education, our prevention efforts. Do we need to get more, out again and provide another vaccination clinic? It just helps us gear up where we need to go.
Dawn. I got a mess here.
I have you on 6.
Yeah.
Sean, not yet. We're still.
Okay. All
Did
right.
you want to go
Oh,
first? You can.
You're good.
Okay.
Yeah, I didn't see her.
All right. Hi, everybody.
Hello.
So looking at the fourth quarter report, I have the numbers for the ADRC. So okay.
Correct. Should be 6A at the bottom. Is it? And there it's numbered 6A, 6B, 6C, D. So that should be a little bit more.
Okay. So looking at those numbers, so October was a little slow, but November and December were quite busy. And that's pretty normal because families gather over the holidays and then it seems like they may see something of concern and then we get a lot of phone calls. So looking at the National Family Caregiver Support Program and Alzheimer's Family Caregiver Support Program, they have both been pretty much full. All the slots have been filled. And for 2025, pretty much all of the money from that grant was used to benefit caregivers in Price County. So that's good. My first year, we had quite a bit left at the end of the year, so I was happy that we were able to utilize all that to benefit our residents. So one thing that's going on with the ADRC is there going to be a change in how billing information is collected. So that's going to happen for us in July of 2026. But right now is when we're preparing to have the things in place so that goes smoothly. So that's something that's going to be happening over the next few months and going to take more of their time to get prepared and get used to doing it in a different way. So then moving to the dementia care specialist, you can see that he's busy doing a lot of outreach in our communities. He's been preparing to add some new memory cafes and support groups in a new support group in Park Falls, or no, memory cafe, excuse me, in Park Falls. And then an additional one, I believe, in Phillips. So he's been adding some extra things. He's been doing the Powerful Tools for Caregiver class, took place in October to November. And then memory screening. So at the Senior Expo in October, he was able to sign some people up for the memory screens that he was then able to do at a later date. So that was very beneficial. Any questions on what Shay's section here or the ADRC? Okay. So then moving on to the disability benefits specialist. So Melody has been handling her own caseload now in the Price County and Sawyer County both. So she's just starting to see some monetary impact as cases are being approved. So that number will go up over time because she's taking all new cases. So I believe she's only had one that's gotten approved to date, but been doing very well and handling a good caseload. So she's caught on really quickly. And then with Adult Protective Services, we have been very busy in that program over the last few months. Many very, very complex cases, a lot of them that have been contested in court. So you can see what our numbers are. And I don't know that our numbers totally reflect how busy we've been, but it is just, they've really been working hard. Just very busy, very complex things. So yeah. Any questions on any of that?
Questions? No?
No? Okay.
Just
So-
a second.
Oh, yeah.
On the referral side for the neglect, risk, and welfare concerns, where do those referrals come from typically?
Multitude of sources. So sometimes they come from a lot from the sheriff's department. A lot of them come from like Inclusa. We get a lot of referrals from them. Sometimes they come from neighbors, sometimes even from family members. That's occasionally from the clinics, but that's probably our main sources. You're welcome. Anything else? No, okay. All right, so then I'm going to move on, if that's okay, to the governing board meeting. So the governing board meeting took place on November 18th, and it was not a really long meeting. From my notes and everything, there wasn't a ton that was discussed, but there were three main things. So the first one was changes to the disability benefits specialist position, but I'm not going to go through the changes because then the state, who had been talking about it for 6 months, then said, never mind, we're not doing them. So that's kind of a wash. So, and then the other thing that was discussed is what I already told you about, the reporting changes for Medicaid reimbursement for the ADRC. And so, like I said, that's taking place in July 2026. So that was discussed at the governing board meeting. And then the last thing they talked about is the use of AI and how and if different counties are using AI at all. So I don't know how much we use AI here. I don't think much. But that was kind of a hot topic of conversation because they're wanting to know, what can you use it for? What can't you? What is everybody doing? Do they have policies? And I think it's something that we're still working on here. Yeah. So that is pretty much from my notes, what had been discussed at the governing board meeting for the ADRC. Any questions on that?
Going back, you made a comment about getting referrals from Inclusa.
Yes.
There's another outfit that provides those services, right? Is that my choice or
Yep,
something?
My
Do you
Choice
get anything
Wisconsin.
with them up here or not?
I don't think we've gotten any referrals from them, and I think that's mainly because they haven't been up here a lot. I know we're just now starting to see some people choosing them. I know initially when people would choose them, it took a long time for services to get in place because they didn't have contracts with a lot of the providers up here, and they were still developing contracts. I did just get a contact from the supervisor of My Choice for this area, and she wants to come in and talk with our staff. So I did arrange for her to come in and do that, I believe, at our March unit meeting.
Okay.
And then she is joining our I-team, our interdisciplinary team that I hold every other month for elder abuse concerns. So that has a number of stakeholders there, Inclusa, it'll now have My Choice, people from Embrace, the different law enforcement. So she's joining that team as well. So it seems like she's trying to be more involved in Price County.
Yeah, and until that elder session we had here in the fall at the Armory, I didn't know My Choice was even an option.
Yeah.
That's the first I had heard of them.
Yeah.
I thought everything was Inclusa, that they had the area and that was it.
Mm.
So that was interesting. Now, people on Iris
Yes.
that have these same problems, how do they handle their stuff?
We do get occasional referrals from Iris as well, but not as many as we do from Inclusa. But I think it's different populations that choose Iris over
Well,
Inclusa.
their self,
You know, Iris is the I self-direct, and so those people tend to be more
respect, I
capable.
self-direct or
Yep,
something? Yeah.
yep. Tend to be more capable of doing that. People that might have dementia or something like that really aren't choosing
Not gonna
Iris.
do
They're
that.
all going to a MCO.
Okay. Thank you.
Okay.
Yeah.
All right. Anything else?
Yep. Thank you.
Okay.
We're postponed, no, we're just gonna be postponed.
Yeah. Okay. Okay. Yeah. Yeah. And on your agenda on this item that we're on, item C, D, E, and F, Chris is not here, so we're not going to get any information on that today. So we're going to move to Jenna. Item 8. All set?
So this would be what quarterly reports. We're probably last time you're kind of running out now. There you go. Watch her, Sally. She had it in her hand.
She's got it here. I was just waiting for.
You got it, Joe?
Behavioral health unit.
The demographic thing, you know,
Right there.
right there. Got it.
You got more there.
Yeah.
Yep.
So it's not really age related.
just said.
All right, everybody ready? Okay, so fourth quarter for behavioral health, you'll see for crisis calls, October again was an interesting month. I think last year we had 21, this year we had 18 calls. November was 14, December was low, which was nice. Because generally around Christmas, New Year's, it's a rough time for a lot of people. But it actually was pretty decent this year. I also attribute some of that to the fact that CCS is growing and some of our other programs, and we're really trying hard to support people in the community so that we're not having as many crisis calls, not as many repeat calls, that kind of thing. So our staff has been doing a really great job and promoting that program and doing, Austin does a lot of research and trying to find providers. And so she does a really nice job with that. So the behavioral health programs, which is the second page, intensive supervision program. We had only had one person in ISP the last couple months, and then December, that person had graduated in November. So, and I know we don't have any in that program currently either, which either means they're not getting drunk drivings or they're choosing not to do the program because it is voluntary. Comprehensive community services, that program you can see in December was up to 21. I think we're up to somewhere between 23 and 25 people in that program right now, plus a couple referrals they're still working on. So that's the one program that I think is really helping reduce some of those crisis calls. Community support program, so that's for the people that are a little more severely mentally ill. That program's staying pretty steady. We're right around 19, 20 people still right now. Coordinated services team is the wraparound program for youth, and we're at about 9 or 10 people as of right now. The last page, children's waiver. What you will see is that continues to grow. We are not allowed to have a waiting list for that program, and in December it was at 60. I think we just got another 1 or 2 referrals in the last couple of weeks. Bobby Joe carries a pretty large caseload of about 53 to 55, somewhere in there.
We're going to talk about this case in a bit.
Yeah. And then Austin, who does CCS, also does some children's waiver to kind of help offload from Bobby Joe, but also some of those kids are also enrolled in the comprehensive community services. So when Kayla was talking about the kids that we're trying to keep out of placement, oftentimes they're in comprehensive community services, children's waiver. Sometimes they're in coordinated services team. We're doing the best we can, offering as many services as we can. And sometimes it's just unfortunately not enough. We're trying, but it is what it is. And then birth to 3 is those services for kids that are obviously from birth to 3 years old and have possibly some delays or disabilities, and getting them some therapy to help support them in growth. And then once they're 3 years old, they can be referred to the school to continue services if needed. So that stays pretty steady around those numbers too. Any questions about any of the programs or any of the numbers that you're seeing? I know the CCL bills are scary when they come in. I know, I look at them too and I'm like, holy cow, but it is a 100% reimbursable program. So that's nice too.
Questions, anybody? Nope. Nope. You got something else that you wanted to?
We will later.
Okay, all right, all right. Thank you.
Okay.
So we're right back on schedule then, huh? Item 10?
Yes.
Okay. Carrie?
Hello, good morning.
Good morning.
Okay, so we have the high cost placements. As you kind of just heard from the quarterly reports, they kind of reflect in there. With the year coming to the end, I don't anticipate these numbers to change too much. Some of the costs that Kayla was talking about, those are 2026, not 2025. So we don't really have anything larger outstanding that I had noticed for those. We did earlier, there was a little question about the budget for the children and youth. That one for the high cost placements, we did drop that down about 43,000, but I mean, when you think of how big the costs are too, that's just a little, that's like a penny. And then for the behavioral health high placements, that we budgeted about the same as we did this 2025.
So we're basically under budgeting.
Yes. But I don't know how you don't under budget with not changing where we are supposed to hit.
I think times it struggles because we don't know what type of placement we're gonna get. We could end up like we're ending up with these ones that need evaluations. That's all of a sudden a 58,000 where some of the placements are just not just foster care, but are in the foster care that are lesser expense wise.
Oh yeah, go ahead, Joe.
So for the high class placements, from the AODA and the children's youth, if you combine the two of those, we're still pretty close, correct? Because it wasn't it before just one high class placement and we kind of split those things up? That, if you look at these two.
Oh,
Because in the AODA, we're basically under budget by what, 60 some? And on the children and youth, we're over budget by about 60 some. So the two combined, we're pretty close. Am I seeing
Well-
that correct, or is that, I'm looking at it wrong?
Yeah, I think we're for the AODA,
Okay, yep.
we're
no, you're right.
over a little bit there. And also children and youth a little bit over.
Yeah, no, I was looking at that AODA backwards.
Oh.
Okay, thank you.
Mm-hmm. And then Sarah gave me permission to talk about something else, so I was very excited about this. We had every year there's this cost reporting that we do. It's the WIMCR Medicaid cost reporting. Other counties have also named it Why I Might Cry Randomly, but I don't cry because I kind of get excited about it because we do get more money back. Essentially, it's lagged behind, but resubmit all of our costs, and it's for people that are on Medicaid and not Medicaid enrolled in programs like prenatal care coordination, the community support program, comprehensive community services, and then case management. So with that, we report all of our stuff. They work some magic behind the scenes, and then we end up getting a reimbursement. So we had gotten our 2024 just WIMCR payments like now in December and January here. So for CCS, we got a little over $22,000. That too, we do anticipate to see that grow now because, that was kind of, now we have Austin in there who's really taking that on. So I anticipate 2025 being much larger than that because now we set the stones earlier and now the program has grown. So now we'll start to see that come more full circle. For crisis, we received just a little under $40,000. That includes 2 years. That was a 2023 and a 2024 payment. So roughly around 20,000 for each. For the community support program, that one is also, that was a little around like 3,500. And then the public health target case management and their PNCC program got a little over 800. So, I mean, it's exciting when you get those big checks in. Were there any questions?
Yeah, why are we getting that money?
Because I do a report every year and they give it to us.
No, it just comes, this is part of the process. It's nothing special we're doing. It's just
Nope,
doing
it's
what we normally do.
yeah, but I think this they started making it's a mandatory report. I want to say it kind of got set into place maybe 2013. Don't quote me. Or they kind of revamped it and added some other things to it. But yeah, all the counties do it. It's something that
Comprehensive too, though. I mean, from managers have to, I mean, it's not just filling out just a few numbers.
Oh gosh, no. That's why people randomly cry.
Yeah.
Okay. Okay, thank you. I'm what?
Okay. Yeah. Yeah. The first thing I want to do is our agency wants to thank you guys for the holiday. They were extremely appreciative when they saw that. They came over and they were like, oh, we were so excited. So I wanted to make sure that you guys know that we thank you guys for that holiday. The next thing is when Shauna was talking, and I have brought it up several times in regards to this children's waiver with the cases of 60. That is one person with 60 cases, which I had indicated that in Eau Claire, they hold a case of 25. I've been working with Carrie and I've been working really hard, and with Nick as well. I'm going to be bringing, just to give heads up, is bringing forward to add a worker. There's no, if we lost her right now for, and we have nowhere to put other cases or other workers to do those cases, I don't want to burn her out, because if we burn her out, we're going to be in a lot of trouble. Like Shauna had said, there's no waiting list in this, the children's waiver. So I just wanted to give you kind of an update. It's going to be sooner than later. Carrie has kind of talked about this is a fully funded as well through this medical assistance too. So I just kind of want to let you know it'll probably be very soon, because like she said, we have 60. I think when she came to my office, there was 3 more cases coming in, and we have no other person to take on those cases. And she's doing just what she can do to hold it down right now. And I know Chana's been helping out and stuff as well. Just give you a heads up on
So
that.
if we add somebody, that's, you say that's fully funded?
Carrie and I have been working on that. Go ahead.
Sure.
Yes, so the CLTS program is fully funded. Again, too, it's, we don't always get the money right away. But we will for 2025, there's what they call like a reconciliation that we do. Let me start over. Okay. The beginning of the year, we kind of make like a budget or like a rate that we think what the whole program is going to cost us. Then at the end of the year, we go and we do a reconciliation of it. And if we estimated really good, then maybe we get a little bit or a little less, or we have to pay back. Or if we didn't estimate correctly, then we get a payment. So they essentially make you whole. So now for 2025, we'll be made whole, usually typically around like May or June of the following year. So it's a little bit quicker and faster of a turnaround than the WIMCR, because that's like a whole calendar year. This is more of like a 5-6 waiting period. But yeah, it is all reimbursable.
So that sounds like we go ahead and add and we incur the costs, and then we give them an estimate with that in it, and we get funded based on that, and then it gets reconciled at the end of the year.
Yep.
Its timing is off maybe a little bit, but
Right.
basically we get compensated.
Mhm.
So have we waited so long?
Well, anyway, I can't turn this on, but.
Yeah, that's-
so I
that's
know
awful
Nick
convenient.
and I have talked about it. So,
There it is.
no, but Nick and I have talked about, but these have grown like exceedingly fast. All of a sudden, it's so.
All year it's been up over 50.
Yeah, and I know that Carrie has found some other avenues to take with this, as I understand that you had talked about with the fiscal part.
Yeah, we're gonna make sure we isolate and
So that, because it wasn't, yeah, we didn't see that. And so when we were reviewing it, she's kind of found how to track it and making sure. So I didn't want to come and ask for a position and then all of a sudden, oh, so she's tracked it. And yeah, so that's what we were more concerned about was the funding.
Quick answer is blame Nick.
I know, because he's not here. Maybe he's on the phone, but we'll blame Nick. No, no, Nick has been very supportive on this. And so
We're still over the average caseload. Yeah.
we need 3 people.
Yeah.
To-
That's interesting. And the children that are going into what is the issue we're dealing with? Why are they going into this program?
High need children.
High
And so they're
needs.
from 0 to 21, special needs, ones that have, I don't believe that mental health, but disabilities that fit into this category. Yeah.
Go ahead.
What are the requirements for the position? Are we seeing that we're gonna have to have somebody with a higher education that it's gonna be harder to fill, or is it?
That's going to be one of my concerns.
Okay.
Yeah, they'll definitely have to have a bachelor's. I'm not sure if we'll be able to find out that they won't need a social worker degree, but probably a bachelor's and probably in a certain area of education or.
Let's do it.
Sounds good to me. 'Cause we
Okay.
need to and then pretty much otherwise we're finalizing all our grants and closing out our year-end reports. And then the next thing is that Bob had asked for our unit here, our organizational chart that I handed out to you today.
Well, yeah, the reason I asked is things change all the time and we keep seeing new employees, and it's nice to be able to put names someplace in a structure to see where these people actually fit in. The other thing is just to know how many people we've got in our unit that are doing all this work. There's a lot of work being done. And so just to see something like this on some frequency, I think is a good idea.
Absolutely.
And then you did this.
And then because on top of your org chart, the Northern Income Maintenance and the ADRC consortium are so small you can't read the counties. So this is the sheet that I had just made up briefly so that you guys could see what the counties it consists of the ADRC and the Northern Income Maintenance. The one here is Forest County, used to be in our Northern Income Maintenance. They are not in our consortium anymore. They have moved to a different one.
Yeah, who did they join?
Why do you have to? Milwaukee. Milwaukee at this time. Yes. So that's who the consortium would take them on. The miles. Yes. So, so I made. They're not in our.
They're not in our thing. Yeah, there must be another whole
Consortium.
Here, right?
Oh, Vilas is here. Vilas. Yeah,
Who's
Vilas.
missing here? Oh, that's Oneida. That's Oneida that's
Link,
missing.
yeah,
Yeah.
Oneida,
Yeah.
yeah. Yeah, they have their own, yes. So, yes, for example, just like as we were talking, if you looked at our org chart and you went over from economic support, children, youth, fiscal, then here's the behavioral health, where we've talked about Bobby Joe. She's the only CLTS worker that's in there. She's kind of second one down on the left side. The other one is our CCS cases. Austin has been doing a tremendous job, and we are receiving a lot of families and a lot of services there, and that is as well is refunded with as well. We may be asking if we keep continuing to get families, she's not going to be able to handle her caseload. So we might be needing, and it's kind of interesting how things are shifting to adult protective services, mental health. The CNY, we don't have the children in ours, but there's definitely significant issues with our children. I mean, so it's all different needs around in our org chart.
Is this what we're seeing on a broader basis I mean, it's not particular to Price County. I can't imagine. I imagine this has
Oh,
to be a broader issue
it
across
is.
the board.
It is.
That everybody's experiencing
Mhm.
the same kind of issues.
Yes,
With the
every-
youth and everything that we're seeing. which is
Yes, yes, that
Really, really disturbing.
for sure.
the
Yes,
trend.
and trying to find,
Yep.
yeah, services.
Yep.
That's the biggest struggle. And we're in the middle of, Price County is in the middle of kind of nowhere. I don't want to say nowhere, but services to travel and to find services and waiting lists for services is unbelievable.
And then you get hospitals shutting down over in the Chippewa Falls area, and that doesn't help. And it just compounds the problems.
Yes.
Yep.
Yep.
Yeah, some real challenges we have facing us. Yes. So.
In our no, younger, junior high and younger. We're seeing it, in our younger kids, very young kids. Yeah.
Anything else before we close? Anybody? If not, we're scheduled for March 11th. I would assume we're going to have that. So that's the next meeting. And with that, we are adjourned. Thank you all.